Ministry of Health officials, led by Cabinet Secretary Deborah Barasa, faced a challenging moment on Wednesday during a press briefing organized to update Kenyans on the progress of Universal Health Coverage, UHC, in Nairobi. The event took an unexpected turn when a group of frustrated patients disrupted the session, demanding answers about the persistent issues and bureaucratic hurdles associated with the Social Health Insurance Fund. The patients, who had traveled from Kenyatta National Hospital, KNH, expressed their anger openly, accusing the Ministry of Health of failing to address the inefficiencies of the Social Health Authority, SHA system. Their grievances ranged from system failures to endless referrals to different offices, leaving them with no tangible solutions or hope of resolution. Amid the commotion, the patients shared personal accounts of their struggles, including how their repeated efforts to seek assistance were met with indifference or redirection to other departments. "We have been moving from one office to another with no help. It's like they are deliberately making us go in circles," shouted one visibly upset patient. Another, holding her infant, echoed the sentiment, describing how officials dismissed their pleas. Seizing the rare opportunity to confront CS Barasa directly, the patients outlined specific cases of neglect and inefficiency. Among them was a mother who had recently undergone a cesarean section and was unable to leave the hospital due to unresolved SHA authorization issues. "We walked all the way from Kenyatta because of this thing called HA. Can you finally tell Kenyans the truth?" one of the patients demanded, her voice shaking with frustration. The chaotic scene was a stark reminder of the systemic challenges plaguing Kenya's healthcare system. Many of the patients questioned how they even discovered the location of the press briefing, emphasizing the level of desperation that drove them to the venue. Present at the meeting was Health Director General Patrick Amah and other key ministry figures who witnessed the confrontation firsthand. The disruption comes against the backdrop of growing unrest within the health sector. Just a day prior, the Clinical Practitioners Union, led by George Gibor, threatened to paralyze medical services nationwide unless the government promptly resolved issues related to SHA authorization and patient care. The union has argued that these delays are jeopardizing lives and undermining the UHC agenda. Furthermore, the incident highlighted the lack of effective communication between the ministry and the public. Many Kenyans remain unaware of how SHA functions or why it has encountered so many roadblocks. Analysts have called for greater transparency and accountability in the rollout of UHC, urging the ministry to address these operational failures before the situation spirals further out of control. As the dust settles, it is clear that the ministry must urgently address the grievances of patients and healthcare workers alike. The growing discontent not only threatens the credibility of UHC, but also exposes deeper cracks in the nation's healthcare infrastructure. Whether the government will rise to the challenge remains to be seen, but one thing is certain: the voices of these patients can no longer be ignored.
We are outside there waiting the gate. We are at the gate waiting. 20 patients. We have walked all the way from Kenyatta Hospital, coming here for treatment. From last week, Wednesday, the systems are not working. And I have come here to protest, to say that they are not working. There are patients in the ward who have been discharged and they have not been treated. This man has a child. Come sit here. He has come all the way from Kibwezi. Come and sit here. His child has swollen a coin. From yesterday, he has been waiting for the SHA to work. It is not working. We have ladies, please, if you want, you can come and join us down there. We have patients who are sitting out there waiting for that SHA, and it is not working. They are not approving.
Ukilipa SHA inaingia, pesa inaingia, hiyo ihang. Lakini matibabu hatupati Kenyatta. Sababu ya nini? SHA haifanyi, sijui OTP haijatumwa, sijui nini. Over there we have many people working. Hapo Kenyatta wako nje, hawasaidiki. Sababu ya nini? Hawezi saidika unless SHA ikuwe approved. Seriously, whoever is in charge, hii SHA thing, so tusaidie. We are going to do a lot. Huyu mbaba mtu wake alimeza koi, hajashughulikiwa kwa pale Kenyatta. Akikufa sababu ya hiyo SHA.
Na mtoto hajakula kutoka jana.
It is not fair, actually.
And please, I'm asking you, as the media, twendeni pale kwa gate.
Thank you for choosing Balindiway News as your trusted source of information. Don't forget to subscribe for more updates and in-depth coverage.